Welcome to radiologyinfo.org. Head CT helps your doctor assess head injuries, evaluate for severe headaches, dizziness, and symptoms of stroke. It also helps your doctor to evaluate your face, sinuses, and skull, or to plan radiation therapy for brain cancer. In emergency cases, it can reveal internal injuries and bleeding quickly enough to help save lives. Your radiologist, a doctor specially trained to supervise and interpret radiology exams, will analyze the CT head images and write a report for your healthcare provider, who will then discuss the results with you. At most healthcare facilities in the United States, your radiology report will be automatically available on your patient portal. You may end up seeing the report before your doctor or healthcare provider does. It is important to remember the report was written for your healthcare provider, and it will likely contain medical terminology and words that you may not understand. Some medical terms in the report, such as abnormal, may look frightening but may not be as serious as you think. Your doctor can help explain the importance of any finding that radiologist mentions in your report. Many things that we see on your imaging are commonly seen in many patients and will cause you no harm. A typical CD head report will have a number of different sections, including history, technique, comparison, findings, and impression. The technique section of the report explains how the CT head was obtained. The CT head may be performed with or without use of intravenous contrast, depending on clinical indication. IV contrast is injected through a vein and helps visualize certain structures and abnormalities within the brain and blood vessels. The decision to use contrast is based on diagnostic needs. In the finding sections of the report, the radiologist will provide a detailed assessment of your brain and surrounding structures, including parenchyma, ventricles, paranasal sinuses, bones, and soft tissues. In parenchyma, they will comment on whether there is evidence of new or old infarct, which is another term for a stroke. Additionally, they will evaluate white matter changes, which are related to microvascular ischemia. It's important to note that the white matter changes are common in individuals over the age of 60 and may be within normal limits for your age. However, moderate or severe changes could indicate underlying vascular issues, such as high blood pressure or high cholesterol, which your doctor may discuss with you. The report will also address brain volume and atrophy. Loss of brain volume, known as atrophy, is a normal part of aging that begins after the age of 40. So its presence does not necessarily indicate abnormal brain volume for your age. The radiologist will assess the ventricles, which are fluid-filled interconnected system, and findings such as ventriculomegaly, enlarged ventricles, or hydrocephalus would indicate fluid buildup. Other possible findings include hemorrhage, such as subdural or epidural, which are types of bleeding in different layers between brain and skull. Additionally, the report may mention atherosclerotic calcification of the vasculature, referring to calcium deposits in brain's blood vessel due to atherosclerosis. The sinuses, which are air-filled spaces in the skull, will be evaluated for signs of infection or inflammation, described in the report as sinusitis or sinus opacification. The report might also include observations about mucosal thickening or mucus retention cyst in the paranasal sinuses and fluids in the mastoid air cells, which can lead to headaches and may be diagnosed as mastoiditis. Any signs of trauma or fracture to the skull bone will be noted in bones and soft tissue section. The impression section of your report summarizes the findings and their interpretation. If the radiologist does not identify any abnormality, the report might state no acute intracranial findings or normal CT head. Keep in mind that it is common for a radiologist to identify findings on the CT head that may require further imaging, and any recommendation for additional evaluation will be mentioned in the impression section. Remember, your radiology report is written for your healthcare provider, and that can make it challenging to understand. However, you have the right to see your radiology report so that you can be better informed about your body and health. Write down any questions or concerns you may have about your report and talk to your doctor or healthcare provider about the results and any next steps. For more information about head CT, visit radiologyinfo.org. Thank you.